Hello and welcome. Hello and welcome. This is Betsy Walker from Broken to Healthy. This is where leading experts are going to share how to heal your body naturally and reclaim your energy and vitality to live your best life. Today, I'm so excited to welcome Dr. Sherri Tenpenny to our show. And it's just a pleasure to have you, Dr. Tenpenny, on the show today.
Thank you for inviting me.
Yes. Oh, it's my pleasure. And I know you're going to share some things that are super, super important for our audience to know about today. So I encourage you all to have a pen and pencil ready, because I know Dr. Tenpenny is going to throw out some stuff that's going to probably shock you a little bit. All right. So I'm just going to give you a little background on her. She's got an amazing background. Dr. Tenpenny is a board-certified osteopathic medical doctor from Cleveland, Ohio, and she has 3 specialties, which I'm not going to get into now. You can tell us later if you want to go into your specialties. But she also founded the Tenpenny Integrative Medical Center, which focuses on health, holistic health and healing, breast thermography, allergy relief, and bioidentical hormones. And she has patients from the US and abroad. And she practices 2.5 days a week in spite of all the speaking and writing she does. So she's amazing, works very hard. She's an internationally known expert on vaccines and their problems. And she's developed online educational courses and is the author of several books and the contributor to many others. And she's made hundreds of appearances on TV and radio. And she is the advocate for free choice in healthcare, which includes the right to refuse vaccines. So I'm going to get right into it. Oh, and I didn't mention that you also have the research library, the Tenpenny Research Library, which has hosts more than 12,000 links to abstracts and full text articles from only peer-reviewed medical literature. So that is a lot, right? Oh my God.
It's a lot. It's a lot. I've been working on this a while. It's not, I've been working on this for a while for sure.
Yeah. So you said it was like 20 years you've been working.
In September, it'll be 20 years since I've been doing this, and more than 40,000 hours I put into this. And somebody asked me if that was a real number, and I sat down and I added it up. It is a real number because of how many hours that I spend per day, per week, per year. Sometimes I've taken like 2 weeks off at a time from my office to just sit down and hammer this out on the computer, like 18 hours a day for 7 days, for 14 days straight. And so, yeah, that's a really legitimate, real number.
Amazing. And if I did look a little bit into the things that you have, and I was so impressed with the courses and everything. In fact, I even signed up for one of the courses so I could learn. Yes.
Thank you.
Yes. So I'm just curious, just in general, what fascinates you, Dr. Tenpenny?
About this topic or in general?
In general. I just want to just know a little bit about you. When you're thinking, oh, I want to know more about that, what gets?
I don't know. That's a good question. I think that because I really focus so much of my time on this. I don't really vary from it very much because I just feel like the inbox is so overwhelming. I have 4 businesses. I have about 20 employees in the various businesses, and preparing talks and getting all the things ready for Vaccine U. I suppose that the things that fascinate me the most that I enjoy doing is, before all this crazy COVID stuff happened, I love to travel. I mean, when I was 29 years old, I decided I was going to see 100 countries before I die. And I'm at 72 right now. So if I hope, good Lord willing, I'll be able to do the rest of them before, they won't shut us down completely. And I love my dog. I love my dog. And so, I've got a little Japanese chin. And so I spend a lot of time with my dog, but I don't spend a lot of time on other things. I feel like I'm so passionate about this topic and I have to dive so deep into it because the inbox is always overflowing with information, new vaccines, new adjuvants, new laws, new regulations, new things that are coming up. things that we need to stand up against, things I need to educate people for. So I don't really have a lot of outside hobbies. I mean, this is what I do. It's who I am, and this is what I do.
Well, that's really, it speaks to why you have such an amazing outreach to people and support. So thank you for that. And I'm glad you are fascinated by how to keep people healthy. And the vaccines being one thing that you've really dove into to really help us understand why maybe we are having health problems. So let's get into that a little bit. I would like you to tell me specifically what is so dangerous that people have to know about in vaccines.
Well, it's all the ingredients. There's more than 203 different chemicals that are used, not in one vaccine, but if you got a dose of all of them, you would get a doses of these chemicals. There's several known carcinogens. There's cells from aborted fetal tissue. There's animal cells, lots of cow blood and chicken fibroblasts. And there's just, there's stray viruses called adventitious viruses. You still have doses of mercury in the multi-dose flu shots. If a child is fully vaccinated for birth to 18 years of age, they'll get 72 doses of vaccine and almost 13,000 milligrams of aluminum. And so any of those things taken together, because synergistic toxicity has never been tested. And so when we give all these various vaccines together at the same time, we don't know what we're doing. And we've never really tested for the types of toxicities that are happening on a cellular basis to our DNA, to our reproductive health, to our hormones, to our brains. It's a pretty egregious system.
Yeah, I recently watched one of your videos, and I would encourage everybody to go out and watch some videos of Dr. Tenpenny's, because she really gets into a lot of this. But what really struck me is you gave a percentage of vaccine injuries on one of the videos about, you know, how just that we don't even know about. And could you share a little bit about that, and how, you know, we're told that, you know, vaccines are supposed to keep us healthy. We're not going to get sick because we take a vaccine like the flu shot or whatever. But we aren't told about the actual injuries, the people that are made sick about them. Why is that?
Well, just because they say it's safe and effective, safe and effective, safe and effective, doesn't mean it's true. I mean, just because you repeat something over and over and over again doesn't make it be true. Vaccines have never been tested for safety ever. They've, pardon me, I take a little sip of cold coffee here. Hold on. They've never been tested against a true placebo. Most of the vaccines have been tested one vaccine against another. Their side effects are followed anywhere from 5 to maybe 21 days long. So the idea of safe is really an oxymoron. When we hear the word effective, we think that effective means it keeps us from getting sick. But effective from vaccine in the vaccine world means that it does what it's intended to do. Meaning when you inject that foreign matter into the body, it develops an antibody. And that's what it's intended to do. And so therefore, scientifically, it is effective. But the caveat is by having those high levels of antibodies, does that protect you and keep you from getting sick? And the answer is no. Because every time they've gone back and done retrospective analysis on measles or pertussis or even tetanus, and they find that people have very high antibody levels, they could still contract the infection anyways. So effective is not a synonym for protection. And we think that they're necessary because we're so fearful of a fever, a cough, a rash, and some diarrhea that we just seriously think that that is not necessary. But it is a very necessary part of growing up and exercising our immune system and making sure that our internal immune system, our Th1 pathways, the innate immune system, the one that we're born with, stays as healthy as it possibly can.
So that brings me to our current situation with COVID. So I went out and I got the antibody test because I thought that I had possibly had COVID, and my family had it. Both my kids had pneumonia February, end of January, early February. My husband and I were really sick. So I thought, well, maybe if I go out and get the antibody test, I'll know whether we had it or not. Well, my doctor explained to me that over time your antibodies go down, and that they might not even show because it had been 3 months. So I did it anyway, and of course I didn't show any antibodies. But I'm curious. So if people are, they do have COVID, and they have those antibodies, are they really protected in the future of getting that again and spreading it to other people?
Well, let's take a step back and with a couple of definitions. The
Hmm.
name of the virus that causes the infection, the name of the virus is SARS-CoV-2. That's the name of the virus.
Hmm.
And it's like when we had bird flu, the name of the virus was H5N1. When we had swine flu, the name of that virus was H1N1. The name of this particular virus is SARS-CoV-2. That's the name of the virus. It
Okay.
causes an infection called COVID-19. The infection, the whole thing about the infection is that it causes a fever, a cough, really deep body aches, shortness of breath, just feeling, high fever, feeling pretty miserable. That symptom complex is COVID-19. And so we somehow in the media, I think the media has been confused about this. We've conflated the two of those, that we use them as synonyms and they're not. And
Mm.
so what you're wanting to know is whether or not you've been exposed to that virus, the SARS-CoV-2, and is that the thing that was making you sick with that symptom complex called COVID-19? The type of testing that they do two types of testing. One is called PCR testing. That's RT-PCR testing. RT stands for reverse transcriptase. So it's RT-PCR, polymerase chain reaction. And that's the most specific type of test that you can get that tests you to see whether or not your illness was actually caused by that particular virus. It's very sensitive for a particular type of virus. It looks around for a little piece of the viral genetics. It looks around for a little piece of the viral RNA. And if it finds it, it says, yes, you've been exposed to that virus, but it doesn't necessarily mean you've been sick. And it doesn't necessarily mean that that was the virus that made you sick. It means that somewhere along the line you were exposed to it. And if you get tested within the first 10 days of being sick, and the chance of that being positive for that particular virus is about 94%. If it's longer than 10 days and you've started to recover, the chance of them identifying that virus, the SARS-CoV-2, as the thing that's making you sick drops to about 60%. And if it's more than 30 days since you've been exposed to that virus, the chance of them finding that little bit of RNA and being able to identify that that SARS-CoV-2 virus made you sick drops to 1%. So if it's more than 30 days, what are they testing? Nobody really knows. And then if you get a serology test, which is the antibody test, and it comes back positive for the IgG antibody, is that really to the SARS-CoV-2 virus? Or is it to one of the other 4 coronaviruses that make people sick on an ongoing basis year after year? Is that a positive antibody test to something that you had 5 years ago? Or is it positive? Is it the influenza-like illness that you and your family had? Did it have anything in the world to do with COVID-19 or with SARS-CoV-2? It could have been Coxsackie. It could have been influenza. It could have been pneumonitis. It could have been metapneumovirus. It could be been a whole bunch of other viruses that cause a very similar like symptom. But because the whole world is on fire right now about SARS-CoV-2 as the virus and COVID-19, there's all those things where they are fabricating deaths in the hospital and just putting, people that think they may have something that looks like the flu and they die, even if they've not been tested, they just put COVID-19 as one of the diagnoses on their death certificate, which is driving up the death numbers and fabricating the data. And I was just on a conference call earlier today with 100 other physicians who all say that the death data is being fabricated, the numbers are being driven up, that the incidence of this infection is far, far lower than what we are claiming it's being, and we're using fear as a weapon to totally disrupt our society. So I just wrote a whole article on this because it's a little bit headsy science and people can really read the whole thing and kind of rehear what I just said. If you go to Vaxxter.com, it's VAXXTER.com, Vaxxter.com, and there's 3 articles there that I've written in the last week or so that I think are important. The first article is called Same Playbook, Different Virus. So we look at how this has happened before in 2002, 2005, 2009, and now we're doing it again. So the name of that article is Same Playbook, Different Virus. Then there's a second article that I wrote that the name of it is called Never Let a Good Crisis Go to Waste. And it's about the PrEP Act, the 2005 PrEP Act, and how we have zero protection from this vaccine. They can make it any way they want. They can put anything in it they want, and the drug companies have no liability. So they could put anything in that vaccine and inject anything into us, and we have no recourse. And then the third article that I just wrote and just released on Monday is COVID-19 testing. What are we doing, and what are we looking for? Because the PCR testing is specific for the virus, but it's inconclusive. And if it's positive, what does that mean? Do we want it to be positive? Do we want to show that we've had this infection in the past and we want to show that we're probably not going to get it again? Do we want it to be positive? Or if it's positive, does that mean that you might be a silent carrier, which is just nonsense? And even the FDA website says the presence of a positive PCR test does not imply that you are contagious. It means there's a little tiny piece of that genetic material from that virus floating around out there. But you have to have the whole virus in order to spread it and be contagious. So if you've got a little positive test and you're completely asymptomatic, it means you're healthy. If you've been exposed to the virus, you've recovered. There's nothing more that needs to be said about it. But yet we tell people to wear masks and wear gloves and social distancing and stay 6 feet apart. Over what? What does a positive test mean? And what does a negative test mean? Does it mean you've never been exposed to the virus and maybe you're susceptible and maybe you ought to stay home and self-quarantine because you're not going to be exposed to the virus at all? So what are we wanting to have as a consumer and as a patient? Do we want a positive test or do we want a negative test? And does anybody really know? And I think the answer to that is it's all political. It has nothing to do with the virus, really very little to do with health, because now they're finding that the people who say died from this virus didn't die because of it. They died because they got an infection. They had comorbidities like emphysema and heart disease and diabetes and obesity. They had comorbidities that they happened to get this virus and they died from their comorbidities, not because they were infected with the SARS-CoV-2 virus.
Wow.
It's a big mouthful of stuff, but it's so important for your audience and for people to really understand that when I first started, that's the reason I wrote this article, because I kept, I'm sitting here at my desk and my TV's right there. And so I would occasionally listen to, the pressers that President Trump did. And I listened to the early on ones, but then I just thought it was Fauci's so much nonsense. And, I've known this stuff about Fauci for decades, and listening to Birx try to sound intelligence, it just, with her political background, I just couldn't take much of it. And I listened to all of this. We got to get tested. We got the best testing in the world. Like, what the heck are they testing? What are you looking for? What are you finding? What does it mean? Nobody's defining that. They just want your swab. And what do they test you for? What are they doing with your DNA when they're done looking for the virus? They know exactly who you are because you send the swab in with your name and address and, maybe your social security number if you're willing to hand that over, or maybe a credit card number if you're going to get it tested. They know where to find you. What does that mean? What kind of tracking are they actually doing? And now that we're talking about these contact tracers, which are just a fancy way to say spies, and people are going to get paid up to $30 an hour to spy on their neighbors and who they're going to be around and who they're going to talk to. And they're going to get trained to be spies. Does anybody know history? Does anybody have any idea what this is looking like historically? Why we're doing this would we have done this over influenza? Would we have done this over coronavirus or over adenoviruses that causes the colds? Would we have done this over pneumonia, bacteria that causes pneumonia? It was an incredible opportunity for a big political move. And they grabbed hold of it because people were willing to buy into it, which makes me really sad.
Yes, well, all the years that you've worked to educate people, and I think people were going more towards, asking questions about whether the flu vaccine was safe or this vaccine or that. I know I was asking questions, and I was actually bullied when I was vaccinating my children. And obviously I can't go backwards. But once I figured out that vaccines were dangerous, I stopped even taking a flu shot myself. However, the pressure out there is high, and all of our people who are middle-aged to seniors, they're pushed to get the flu shot, and they're pushed to get the um, uh, what is it? It's not chicken pox, but the other one,
Shingles.
the shingles shot. And what's that doing to their brains, and the chance that they're going to have dementia or Alzheimer's and all these things that they don't even know. I don't know. I mean, when I listened to your video, I was much more educated about that. Even though I knew in my heart that that these things are very dangerous. It's important that we actually arm ourselves with the facts, and that's what you're really giving people through your websites. So you mentioned you have Vaxxter.com, where you publish these articles for people to have information. So that's an awesome site. Is there anything else on that site that you'd want to direct people to?
Yeah, we have a cadre of writers that write, very intelligent, upbeat, or very intelligent, highly referenced articles for Vaxxter. It's not just me. You can find a lot of things. There's a search function on the Vaxxter site. It's VAXXTER. And one of the things that I really hope that every single person that goes out there and goes to Vaxxter will do is sign up for our newsletter, because we never know when we're going to be taken down from social media. So we want to have a way to be in contact with you. And you can go to Vaxxter, and it's right there. There's a form. Or if you're listening to this on your phone, you can text MVI, which stands for Mastering Vaccine Info, MVI, and you can text it to 555-888. So text MVI, Mastering Vaccine Info, MPI, to 555-888, and that will put you into you'll get an autoresponder to add your email list, and that will go right into our database. And then we have a lot of other really, really good writers that are writing a lot of really interesting things right now about vitamin C and how to interpret studies and what's happening with 5G. And so it's just a really higher level sort of site. It's not really a bloggy site. It's really about articles. But we have a lot of internet offerings. We have a lot of courses that we offer online. In fact, vaccineu.com, vaccine the letter u.com. We just released 7 courses last week on behavioral and language courses, on how to talk about this information and communicate it better without getting angry, without getting frustrated, how to communicate with your spouse, how to communicate with your children about these lockdowns. And so if you go to vaccineu.com, and up at the top, there's a button that says catalog, and you click on the catalog, you can look at all the different course offerings that we have there. But to find out all the stuff we do, because we do a lot of stuff, Betsy, we do a lot of different things.
Amazing.
If you go to courses4mastery.com, courses, the number 4, mastery.com, courses for mastery, that will show you all the different elements of the different educational offerings that we have between our boot camp, Vaccine U, the tenpenny research library, our 2 social media platforms we just launched, what my clinic is all about. I mean, there's a lot of stuff there. So I created that landing page so that people could see it all in one place and not have to remember all these various different sites. You could just go to Courses for Mastery, and it's all there. It's all right there.
And so there's a link from there to Vaxxter as well.
To each one, yes, to Vaxxter also, so to all the different sites that we have.
Yeah, so I think it's important that people realize that they could take away our ability to have this free speech and this freedom of expressing ourselves. And that it's important that we connect with you and through your sources so that we can continue to stay educated no matter what they throw at us in terms of, what they shut off. I mean, it was, there was a big thing where the Google and Facebook just totally took a lot of videos off because they felt that it wasn't in the right political vein.
Yeah, anything that's non-mainstream propaganda these days, just about anything, is being swiped off of Google. I mean, swiped off of Facebook and swiped off of YouTube. that's what we've just launched two forums for that. Disseminate.tv is a place where people can put up all their videos and never be worried about censoring and taking down. The only way that you'll be censored is if you're doing something illegal or illicit, but you can put anything up there, and it's really safe. If I told you all the backdrop on all the safety tests and things that we've done, it's pretty incredible. And so that's disseminate.tv. And then we have another social media site that if you get tired of getting all your stuff taken down and scraped off of Facebook, you can go to uniting.zone and set up a free account, and you'll be pleasantly surprised how familiar both of those two sites look.
Great. Those are great sources for us to all know about. So I'm so happy that you share that with us. I guess I really want to hone in more on how do we make these choices like when we're pressured. So I know some of your courses go into that in terms of how do we change our thinking so that we are strong. And maybe you could give us a few tips about that, because you're going to go to your doctor and they're going to say you need to have the pneumonia shot, and you need to have the tetanus shot, and you need to have all these things. How are you strong enough to say no, I don't?
Well, a couple things. First of all, knowledge is power, right? So if you understood a little bit more about what they were offering you, what was coming through what was in those vaccines, and what was coming through those needles, then you really would not want to have that injected into your body. So
Yeah.
if you understood a little bit more about what was coming through the needle, you would make it a whole lot easier to say no. The other thing is that we've got to stop this bullying inside of the medical industry. We must just stop it. I mean, you would put up with bullying from your doctor that you wouldn't dream of putting up with bullying from anybody else. I mean, your next door neighbor, your CPA, your attorney, your mother-in-law. I mean, you would never put up with some of the ways that they condescend to you and try to make you feel guilty because you're not demanding to be vaccinated. I mean, why would you ever refuse such a wonderful thing that I want to inject into your body, right? And you get condescended and bullied. And so, one of the things that we teach you is that you understand that this needs to be an adult to adult conversation. And in order to do that in the room, like if you're sitting in the chair and the doctor comes in and he's standing up and starts to condescend to you, one of the simple things you can do is to stand up. Just stand up. You don't need to be aggressive. You don't need to, but just stand up. So now you're not looking up at them with this parent-child sort of way of communicating. Now you stand up and you're eyeball to eyeball, and you have an adult to adult conversation. And you change, you pivot the conversation and saying, doctor, I wasn't here to argue with you about that. I've pretty much made up my mind. What I'm really here to see you about is whatever you went there for. Annual physical, you had a bladder infection, your back hurt. I mean, whatever you were there for, you weren't there to be bullied about vaccines. So just pivot the conversation and direct it back to what you were there for. And if he tries to pull it back, said, no, we're not talking about that today. What I'm really here to see you for is whatever it is, and tell him that. And keep in control and keep in charge of that conversation. And you're eyeball to eyeball. Now you're having an adult to adult conversation, not a parent-child conversation. Mm-hmm. And then that's one very important tool that you can do. And you can use that little trick of the trade in any type of situation. It doesn't have to be your doctor. It could be your CPA, your lawyer, your pastor. It could be anybody, that tries to condescend to you and make you feel guilty or talk down to you like they know more than what you do. That's a simple little way you can pivot that conversation.
Thank you. Yes, that's very helpful. I know that your energy between two people can change just by your posture.
Right.
Sure. Awesome. So given the times we're in, do you have a couple, 2 or 3 tips or whatever you would give people in order to stay healthy without a vaccine, so that they can actually feel confident that they can be out in the public and not worry about contracting a disease that's going to kill them, right?
An infection, an infection,
right?
Not a disease. We contract infections that can cause illness. A disease is something and that's the other thing I've worked really hard in the last year to try to get people to lose some words out of their lexicon. One word that I think I've done a pretty good job in killing over the last few years is the word immunize and immunizations. It should just be gone from your language, because injecting foreign matter does not in any way keep you immune. You're getting injected with foreign matter, and the act of doing that is called is vaccinating. The stuff that's being injected is a vaccine. Has nothing to do with being immune and being protected. Nothing. So immunize and immunizations need to just go away. Just not use it anymore. Using the word, calling measles a disease has to stop. It's not a disease, is something that comes and stays. It's like muscular dystrophy or seizure disorders or cancer. Those things are diseases. They come and stay. Measles comes for 7 to 10 days and leaves behind a lifetime of immunity. So it's an infection. And infection sounds a whole lot less scary than the word disease, which they have put that word disease into our brain for a reason. It's more of that fear-based nonsense. So words are, thoughts are things, and words have power. And using the appropriate words when we're talking about getting an infection is really, really, really important.
Thank
So
you.
one of the things that people need to do, I do think that, I tend to be a really optimistic person by nature. I tend to look at the world through glasses half full, and I always say that good things can come out of bad things. You just take those lemons and make lemonade. And one of the things that we are paying closer attention to, which I think is a good thing, is hand washing, personal hygiene. And but my concern is that I'm hoping that the pendulum will swing back. We've made people obsessive about washing their hands and not touching anything. I'm hoping that we'll get back to some semblance of, wash your hands appropriately, but not obsessively. So we don't end up with an OCD country about
Well,
every single thing is hand washing,
right.
right?
Well, also with the antibacterial hand soap, I
Does
mean,
nothing for viruses, nothing.
yeah, and it's got chemicals in it, which goes into your bloodstream. And
Right.
then, there are bacteria, am I right, that are good for us to have out there that we need to keep us strong.
We carry around somewhere around 1.3 trillion viruses and bacteria on the surface of us and on the inside of us, in our nose, in our mouth, in our lungs, in our intestinal tract, in our vagina, on our skin, in our ears. We carry around these viruses and bacteria, a trillion of them. But the only ones we get our knickers in a knot over are the ones we're going to have a vaccine for. Those are like the bad guys, and everything else doesn't really matter. And so we have to be careful, like what you said, about killing off the good guys, because we are in a symbiotic relationship with the viruses and the bacteria. They're part of our microbiome. I mean, we just are.
Right.
So I think that if you're going to test anything, get a vitamin D test. Find out what your vitamin D level is. It needs to be somewhere between 80 and 100. Get an iodine level test. Your iodine level should be somewhere between 80 and 100. Iodine is your body's natural antiseptic. It's not just about your thyroid. It's important to see where that level is. It's really super important to know that your D is between 80 and 100. You should be taking vitamin C ascorbates. That's the form of vitamin C that I most prefer. And it usually comes as a powder. And you should be doing vitamin C ascorbates to bowel tolerance, which means when you first start taking it, take a couple thousand milligrams every couple of hours until it gives you diarrhea, until it makes you poop. And when you get to that point, whatever total milligrams per day that you've taken, when you get to that point, it might be 20,000, it might be 30,000, cut that amount in half. And then that becomes your steady state for the next few days until you start getting diarrhea again. And then you cut it in half until you get, and that might be the dose where you stay at in perpetuity. But that's the whole concept of vitamin C to bowel tolerance. And vitamin C then helps to boost up and puff up your white blood cells so they can take care of any viruses and bacteria that come along. So you've got D and C and iodine and vitamin A, somewhere around 10,000 IUs a day of vitamin A. And stay away from white sugar, white flour, white cow's milk, and white rice. White sugar, white flour, white cow's milk, and white rice. In our office, we call them the great whites. We want to avoid the great whites because they're pro-inflammatory and they do nothing but They do nothing but offer you empty calories. And in order to detox those things from your system, you have to like leach out a lot of minerals. So white sugar, white flour, white cow's milk, and white rice are just empty calories and should not be in your diet.
Thank you. Those are some really good tips. That's some like those are golden nuggets for people. So thank you so much for that, Dr. Tenpenny.
You're welcome.
Unfortunately, we're getting close to the end of our time, and I know you have something for our listeners, and I want you to talk a little bit about the free gift you have for them.
Yeah, I wrote an ebook a while back. It's not real long, but it has it's full of punchy information. And the title of the ebook is The Importance of Fever. And I look back over the medical literature on where did we become so fever phobic? And that's an actual term that they actually use, because parents aren't trained appropriately on what to do when their child has a fever. They think that a temperature of 99 is serious and they're just going to die if you don't do something to like put that fever down right away. But fever is so important to our overall health. It gets rid of the things, the pathogens that aren't supposed to be there. It exercises your immune system. It helps your both arms of your immune system, the Th1 and the Th2, work better together. So I wrote this little ebook, and to give it away to everybody that's watching who logs in, is called The Importance of Fever, and I think you'll like it a lot.
Thank you for that. That's going to be a great tool. I can't wait to download it myself. I
Great.
know that it's really hard, especially with me and children. You don't want them to be miserable, right? But I know it is important to have for them to have a fever. So I guess there's some things you have to weigh. But yeah, so thank you for that. I'm sure
You're
everybody's
welcome.
going to really benefit. And thank you again for spending time with us today
You're
and
welcome.
filling us in about vaccines. I know we've only scratched the surface. And so I would encourage all of you listeners out there to go to these websites. All this will be listed on the page here where you're viewing the video. Her link to her free gift and the websites and everything will be there for you. So take some time to really educate yourself, because if we don't, then we're going to be manipulated and probably make some decisions that are not good for our health.
Exactly.
So
All
thanks
right.
again. And
Thank you so much.
I encourage you all to continue to watch the next interviews that are put out and stay with us from day to day as we present new speakers and hopefully improve your health through learning and educating yourself. And I hope you have a wonderful day, Dr. Tenpenny.
Thank you so much, Betsy. It's been a pleasure. Thank you.
Likewise for me too.